17 states, it was the same information in almost every 17, in every state.
Well, yes, and we actually saw some of that here in Tennessee. And there's no getting around the fact that when race becomes a part of any of the conversations in this country, things get complicated and very difficult. So I think we need to focus on something called the vulnerability index, where you account for all factors related to health disparities, where you live, your educational level, how much money you make, the kind of jobs you have. If we frame it in that context, it makes it a little less challenging to make sure the most vulnerable populations get it. Because again, we know that brown and black people are the most vulnerable, but it just appears that when we start to frame this in the context of race, it makes it very challenging for some people. So I think we have to focus on the vulnerability index. If we do that, I think we can get this done. But you can't get around the fact that when race becomes part of the conversation, things get really more challenging. And I think that's what we're up against in this case.
I'm entirely with you, which is why I think that there should be universal health care coverage, because then you get around all of this stuff. You don't have to talk about it in terms of race or poverty or vulnerability. But the bottom line is you mentioned this, our actual healthcare system isn't set up to deal with the most vulnerable in society. So why would our testing regimen be able to deal with that? Why would our vaccination program be able to deal with it? We needed to recognize that we can't deal with it, so we needed a different way to vaccinate everyone.
I totally agree. And I think that what we need to do is to empower and mobilize trusted organizations and take the vaccines to where the communities are. And churches would be a great place to do this, because in most communities of color, churches tend to be a place where people feel safe, they trust the faith leaders there. So I think that that's one example of what we could do that might make this much more effective. I also think that some of the things that are being contemplated speak to the fact that people are not being sensitive to the challenges we have. I think in Florida, they're going to be using Publix, and there are a lot of Publix in Florida, Publix grocery stores, but they're not in places where poor and black people live. And that doesn't account for the challenges we have. I think it's a great idea to use grocery stores, pharmacies, and those kinds of places as vaccination centers. But you got to make sure you also do that in the communities where they're most needed. The bottom line is the most vulnerable populations to disease and death are people of color. If we're going to save the most lives, then they should be prioritized to getting the vaccine. That's just the bottom line. And if we're going to save as many lives as possible, that has to be the focus. There's no getting around that. But as I said earlier, the problem is that when we start to talk about race, and race is a factor here, that just seems to be a challenge for some people to wrap their heads around that. But that's what we're up against.